this video, I want to describe and demonstrate palpation at the posterior pelvis, posterior thigh, and a little bit of lumbar palpation. So we're going to start with our bony landmarks and kind of figure out where we are. So iliac crest palpation, we're going to sink in with our web space and feel the top of that iliac crest. That's going to be roughly at the level of L4, so we'll kind of talk about that regionally in the lumbar palpation. We also want to palpate on the posterior pelvis, the PSIS, so you can sink deep in here and kind of come up and under with your thumbs and palpate the PSIS. Some individuals will have little dimples, and that will be roughly at the level of the PSIS. So from PSIS, we know one of the key ligaments is going to be the long dorsal sacroiliac ligament. So that's going to run from the PSIS to the sacrum, kind of in this direction. So we can palpate from those landmarks. Also, off of the PSIS, if we sink medially and a little bit inferior medially, we're going to be roughly over the sacroiliac joints. So that might be a nice space to palpate for individuals and try to differentiate between sacroiliac pain provocation versus lumbar regionally. Just medially to that PSIS, you can sink in before you get to the sacrum, and that's going to be what we call the sacral sulcus. So again, that's kind of a landmark regionally to palpate. The other thing we want to palpate for is the sacrum. So I can palpate with the heel of my hand. I can feel the sacrum. The sacrum is going to be this triangular shaped bone, and almost counterintuitively, the base is going to be at the top, the apex is going to be at the bottom. So I can palpate the base, I can palpate all the way down the sacrum, and I can palpate the apex. The other thing I'm going to want to palpate is the coccyx, and I palpate this, I tend to palpate this the same way I would on the front of the pelvis with my fingers up top and the heel of my hand down low. I feel like that is a nice way to preserve patient privacy but still palpate that bony structure. So I'm just going to sink deep in, and I can palpate the coccyx as it articulates with the apex of the sacrum. The other thing that I'm going to want to palpate, if we envision this triangle, is I can find my PSIS again, and I can follow the border of the sacrum down to where it kind of disappears and becomes deeper within this gluteal fold, and I'm going to palpate inferiorly, what we call the inferior lateral angles. So right before that apex, the inferior lateral angles, that's another bony landmark that I can palpate on the sacrum. The other things we want to palpate are gluteal muscles in this posterior hip and thigh. And for the gluteal muscles, I think it's helpful to envision or remember where these are anatomically. So we see on the model, the posterior ilium. Remembering that these gluteal muscles is a three muscle group, and the gluteus maximus is going to be the first one I talk about. So the insertion here on the ilium is going to be at the posterior iliac line, and then we're going to have the gluteus minimus, which is going to be between the posterior and the anterior gluteal line. I think I said iliac line, so I apologize for that. It's the gluteal line. So posterior gluteal line is going to be glute max. Between the posterior and anterior gluteal line is going to be the glute min. And between the anterior and inferior gluteal line is going to be the gluteus minimus. And that's going to be really hard to palpate. Primarily, we're going to palpate the gluteus maximus as it comes from this attachment point to distally. We described it attaches to the gluteal tuberosity as well as the iliotibial band, the IT band. The gluteus medius is going to attach roughly in this area. We're going to find it right around that iliac crest. Glute max is in this direction. Glute med is going to be kind of the superior portion, most superficial. It's going to be easy to palpate here, and it's going to insert distally on that greater trochanter that we saw. So we're going to find that by locating our iliac crest, and we're going to come down, if you can kind of envision on the model where we were. And the gluteus maximus is pretty easy to find. We're going to palpate, we can palpate all the way down to the posterior femur, all through that muscle. Notice I'm utilizing a hand over hand technique. I'm applying a good amount of pressure to sink into the muscle. I'm not just poking her, okay? The other thing that we can find if we come off of that iliac crest is that gluteus medius muscle is going to be right in here, okay? And we can, again, follow that down in this oblique fashion to its distal attachment of the greater trochanter. The other muscle groups that are going to be deep below those gluteal muscles are going to be our deep hip external rotator group, and they're going to attach distally to this greater trochanter. I remember these by the acronym P-GO-GO-Q, so a little bit of anatomy review. Those deep hip external rotators are going to be piriformis. First G is going to be our superior gemellus. Gemelli or gemellus just means twins. O is going to be obturator internus. Second G, gemellus, inferior gemellus, and then our obturator externus. Q is going to be quadratus femoris. So P-GO-GO-Q gives me a nice little acronym of how to remember those little deep hip external rotators, but so important. The piriformis, however, we do want to try to palpate and select out of that muscle group. And if you remember the attachments of the piriformis, we can visualize on the model. It's going to run from the anterior sacrum through the sciatic notch, and when it's closed via the sacrospinous ligament, it's going to be the greater sciatic foramen. So the piriformis is going to exit here with the sciatic nerve, and it's going to attach distally to this greater trochanter. So we can follow that oblique line, and we can utilize our landmarks and palpate deep and try to palpate the piriformis. So if I come in here and I find the sacrum, obviously I'm not palpating on the anterior sacrum, but my hand's on the sacrum, and I can palpate at the greater trochanter, and I can envision this is the line of that muscle. I'm going to come to the middle third, find this is the easiest place for me to palpate. I'm going to sink deep, and I'm going to palpate here. The other thing I can do is I can have the individual actively externally rotate against resistance. So go ahead and pull into my hand. Pull, pull, pull. Good. And I can feel that muscle come on tension. Because it's a deep muscle, that's a really nice trick to see if you're in the right place for palpation. The other structures that I want to palpate here are if we sink below kind of the gluteal fold, we're going to palpate the ischial tuberosity, or sometimes we can tell our patients, I just want to palpate, I want to touch the bone that you sit on, is that okay? And you can sink deep in there. And we can remember that that ischial tuberosity is going to be a common attachment for the hamstring muscle groups as well as the adductor magnus. So hamstring muscle groups laterally, we're going to have the biceps femoris running from this ischial tuberosity all the way down to the fibular head, and then medially we're going to have the semimembranosus, semitendinosus running down, crossing the knee to their attachment sites. Let's see, the other things that we wanted to describe and talk about are the other ligament that I think is worthwhile palpating that is not as deep. So sacrospinous ligament, we do want to know where that is, but it's going to be difficult to palpate. Sacrotuberous ligament, we could palpate. So just as the name says, it's going to run from the sacrum to the ischial tuberosity. So I'm already on the ischial tuberosity. Here's the sacrum, so I can kind of palpate at those sites and in between and see if that is provocative at all. We also want to palpate posteriorly lumbar, regional anatomy, and bony landmarks, and in particular, probably want to start by palpating spinous process of the lumbar spine. So I'm going to come back, I'm going to find my iliac crest. As I mentioned earlier, it's going to be roughly at the level of L4, so I think that this is going to be L4 spinous process. If I come below, and I can kind of sink into a divot and then come back out on top, and that's going to be L5 spinous process. I can work my way back up. So L4, you have a little depression, L3 spinous process, a little depression, L2, and then I'm moving up to L1. So this is going to be my TL junction or thoracolumbar junction. I can palpate the first, or T12 at thoracic level 12 spinous process. I can also come in and try to palpate that 12th rib. From that 12th rib, a key muscle is going to attach from the 12th rib to the iliac crest, a little bit lateral to the erector spinae is going to be the quadratus lumborum. So I can sink in and I can palpate through the quadratus lumborum muscle. I can also palpate the erector spinae. And notice that I'm utilizing a hand-over-hand approach, and I'm also palpating in an oblique direction to the muscle fibers instead of running up and down. I find that oftentimes that's a nice way to palpate this muscle group. And the erector spinae, if we remember, are going to be iliocostalis, longissimus, and spinalis.